Councillor Prendergast is appropriately a midwife opening this debate on health.
Tipperary loves being first, delegates. I'm hurling those remarks to those in the audience from Kilkenny and Cork. Good morning, delegates. A key objective for the Labour Party is to transform our health system into a fair, efficient and responsive service that will meet the needs of families and communities all over Ireland. As a midwife working in a busy hospital in Clonmel, I know all too well the problems faced by patients in getting rapid access to decent health care, and I know too well also the great pressures placed on staff working in that system. There are no quick fix solutions in health, but surely we can do better than the system we have at present. A planned, properly funded, strategic approach can deliver good quality care at an appropriate level of access for the entire community. The growth in our population to more than 4 million has put additional strain on our services, and this growth in population must be factored in to our planning for the health service as the increased proportion of elderly, which we now have. Labour wants to see far greater emphasis on the provision of primary care, but what is meant by primary care? The World Health Organization describes primary care as first contact, front-line, ongoing, comprehensive and coordinated care. For most people, the local family doctor is the face of primary care. What we want to do is to make it easier for families to access their GPs. If we do this, apart from meeting health needs in a more efficient and effective way, it will also reduce the number of people going directly to hospitals and adding to the pressure on the accident and emergency units. There are also other advantages. GPs are part of the community. They live in the community. They know their patients. They know their medical histories. In many cases, a local practice or the GP that you have as a baby will see you through your entire life. The cost of going to a GP has increased and can, for some families on low incomes, create real problems. The traditional system that has been used to help families in this situation has been the medical card. A medical card not only gives free access to the doctor, but also ensures free drugs and other primary care facilities. Unfortunately, under the government that we have presently, families with medical cards have been allowed to fall. When Labour was last in government, almost 35% of people had medical cards. Under Micheál Martin and Mary Harney, this has been allowed to drop to just 29%. The fall is all the more extraordinary given that the economic growth in the country that we have experienced over the last 15 years, it has been phenomenal. When he came to prepare his budget in December, Brian Cowan had $5 billion more than he expected. He could have used some of this money to fund additional medical cards for our people who were so deserving. Labour in government is committed to bringing the percentage of the population with medical cards up to 40%. We will do this over the lifetime of the next government by increasing the income thresholds to more realistic levels and by ensuring proper weighting for children when assessing eligibility. This move could transform our health service. It would ensure easier access for families to their GPs. It would reduce the often penal drug bills faced by families, particularly those coping with ongoing illnesses. It would lead to earlier identification of health problems and earlier intervention to deal with them. It would ease the pressure on our accident and emergency services. It makes sense and Labour will do it. Thank you, delegates.